Yes.
Hey, everybody.
Hi.
Hi. Good to see you all again. Everybody okay? Didn't have trouble signing in this time?
Oh, not really. It was okay.
Okay, good. We're all getting the hang of it then. We're still trying to get things smooth on this side too. Okay. Great. So let's see. Right now it's 2:03. 2:02. I think we can go ahead and get started. I'm kind of wondering where some of our hub team is here. Do we have Juanette somewhere or Maribel? Do we have Shane or Juliana here? I'm not seeing.
Hi, Dr. Wen.
Hi, who's that?
Debbie.
Hi. Great. All right, maybe we should just go ahead and get started and hopefully other people will join us shortly. Let me just, okay, great. Okay, anyway, welcome to our Care Home Echo series. And our purpose is to help you deliver the best care for our kupuna living in our care homes and our family foster homes. So next slide. Oh, wait, it's me. I have to drive it. Okay, next slide. Okay. ECHO is a model of online education that started in New Mexico. And so these are not just lectures. This is a forum where you and me and everybody here can learn from each other's experiences. It's a safe place to ask questions about what you see every day, the challenges that you face every day. And as the ECHO model goes, it's all teach, all learn. So this is our community. This is our community of learning. So the other benefit of ECHOs, right, is free, right? There it is. It says free. It's convenient and you don't have to leave your home. You don't have to leave your clients at home, right? Unattended, you can still be there. And you can get continuing education credits. That's free too. A little bit about the format is that we give a short lecture. We'll share expertise from the team, and then we're open up for case discussions. I'm going to invite you to ask questions and share your situations. And our team is willing to, teach and share, and we share all of our collective wisdom together. Okay, next slide here. So we have a couple of ground rules. One, we have to keep patient confidentiality. So that's what we call HIPAA compliant. So no personal identifying information. This is a safe place to learn and share, and that this, just remember, this is not an official doctor's consultation visit, right? So this is a forum for learning and sharing. Okay, just hopefully you're a little bit more used to it from last time, just a little bit Zoom logistics. There is a chat tool at the bottom of your screen. And if you could enter your name and the names of other people who are looking at the same screen with you, that's our way of taking attendance. And then you can also put your organization if that's relevant too, and then hit enter, otherwise it doesn't go into the chat box. So if you can all do that, that would be great. There is also a mute button. If you kind of look on the bottom left again, it looks like that. And so if you're not speaking, make sure it's on mute, but please click it to unmute it, and because we want to hear from you if you have things you want to share. And of course, feel free to click in the chat box anytime you have questions, even in the middle of me talking, because we can always come back to those questions when there's a break. Okay, this is the calendar of our sessions. Last month, we did monitoring patients for COVID-19. Today, we're going to talk about COVID vaccinations. And then we're going to talk about dementia and dementia behaviors next time. And as usual, third Thursday of each month from 2 to 3 p.m. So if there are topics that you would actually like us to cover in the future, please let us know in the chat box or when you complete the evaluation forms. That way we can meet your needs. Okay, and with regards to continuing education credits, let's see. So doctors can receive CMEs, and it's sponsored by the Hawaii Consortium of CME, but nurses can also get CE credits, and social workers can get 1 hour CE credits as well. And others can receive certificates of attendance. So all you need to do is complete an evaluation. There's a link over there. And actually, we're going to walk you through it at the end. I know it was a little challenging last time. So at the end of our session, we're going to just end slightly early, just a couple of minutes, and Michaela will kind of walk you through that again and make sure that we get that down so that you can get your continuing education credits. Okay, and just introducing the hub team, which I hope has shown up by now, right? So there's me. I'm with the Department of Geriatric Medicine. Juanette Gaylord, is she here? If you are, please wave hello, chime in. Or Maribel Tan. And Shane Anderson. Oh. Okay, and Juliana Caldwell from Aloha Care. But I'm not seeing them right now. So anyway, so make sure you introduce yourself in the chat box and add the names of the people in the room with you. And that way everybody can get their credit for attending. Okay, great. Okay, so today's topic is COVID vaccinations, and I will be presenting this one. And actually, if Dr. Douglas Hatch, he is from the Department of Health from HIEMA, and he will be present as well. Hopefully he'll join us shortly in case you have questions for DOH. Yeah. So anyway, just to let you know, I do not have any relationships with commercial supporters as to be a conflict of interest. So that's said. Okay, great. So now I am going to pull up the lecture. Hold on, here we go. Let's see if I can put this in here and make it there we go. Okay, so let me just pull this up for a second. See, oops, that's not what I meant to do. Okay, great. COVID vaccination. So just thought we'd review briefly, how do these vaccinations work, right? How does your body fight disease? So if you haven't seen, this is what the COVID looks like, right? You've been seeing pictures of this all over the place, right? It's this virus that all these little spike proteins. But basically, foreign proteins from invaders are recognized by your body's cells, and they're called antigens, right? And then your white cells in your body, they gang up to fight off all of these antigen enemies. And then some white cells produce antibodies that fight specific targets. And so these antibodies, these little Y things, they only attack antigens that matches perfectly with their target. And it can take weeks, days to weeks, for the body to learn who the enemy is to attack it. And so some people can fight infections better than others. And if your immune system is weak, the virus will multiply faster than the body can kill the virus. And so that's why we want to have a really strong, robust immune system to fight these things before the virus takes over. And so, for example, if your body is weak and you don't have a strong immune system, some of your care home clients may get very sick and may even die. So this is how vaccines work. So what happens is when you give a vaccine to the body, it's like putting up a wanted sign, and when your body actually, so it sort of says, here's what your virus looks like. If you see something like this, attack it right away. And so when it actually encounters the enemy, it responds faster and stronger to get rid of the virus before it gets you super sick. So the vaccine introduces this picture to the enemy, about the enemy in a safe way, because it's not actually introducing the virus into your body, just a picture of the virus, you know, a tiny code of it, the spike. And when it recognizes it again, it's going to come and attack it faster and harder. So that's kind of what it is. So I'm in the next slide. Yeah, so I'm just going to actually show you a short video that kind of explains this, how this virus vaccine works, the mRNA vaccine. So hopefully that'll be kind of interesting to you and it might give you a better sense of what this is like. So I'm just gonna, let's see how I'm gonna move this over here. Let's see if I can show that. Oops.
A very lengthy process, taking on average 8 years to get approved. Since a few years, we have the ability to create mRNA vaccines, which can be developed much faster. So how do these vaccines work? Are they safe? And how do they compare to traditional ones? But first, you must understand how the immune system works. When a virus enters your body, it will attach itself to one of your cells and inject its DNA or RNA into it. This is like a blueprint for your cells, containing instructions on what the cell has to make. So in this case, the virus's RNA will tell your cell to make more copies of the same virus. They become factories, assembling new copies of the virus that can infect even more cells. But don't worry, our bodies have a defense system for foreign intruders. The immune system attacks any protein, virus, or bacteria that does not belong in our bodies. But it takes a few days for it to learn how to attack the intruder. Meanwhile, the virus factories are running non-stop, quickly replicating the virus and spreading it in your body. In other words, you start experiencing symptoms of whatever has infected you. After a few days, however, your immune system will have figured out how to attack the virus and will start producing antibodies. These attach themselves to the virus, preventing them from infecting more cells and marking them for destruction. As you can see, the immune system is remarkable, but it's slow to mount an attack. That is the reason why we can get sick in the first place. So to give it a helping hand, we developed vaccines. The main idea is to train your immune system to recognize and fight off an infection before it has occurred. Almost like showing your immune system a mugshot of the virus and saying, if you see this, kill it. There are various types of vaccines, but let's take a look at the new kid on the block, mRNA vaccines. To understand how they work, let's take the COVID-19 pandemic as an example. You might have seen pictures of the virus with its distinctive spikes. These spikes allow the virus to attach to specific cells in your body and infect them. Now, here's the key idea for the COVID-19 vaccine. What if we could train our immune system to recognize these spikes by having our own bodies produce them? To do that, researchers took the virus's blueprint, its RNA, and isolated the part responsible for producing the spikes. Armed with this blueprint, they created mRNA, or messenger RNA. This is a special form of RNA that can enter your cells and give them instructions. In this case, the RNA contains instructions to build the spikes of the coronavirus. Not the virus itself, just the spikes. So mRNA vaccines contain instructions for your cells that tell them to build a part of a virus in large volumes, almost like giving them a recipe to follow. Once this is happening, your immune system kicks into action and starts learning how to attack these intruders. Again, it takes some time for the immune system to fight off these spikes, but you won't get sick because it's only the spikes, not the virus itself. And that's it. Your immune system has learned how to attack the spikes of the coronavirus. It destroys all the spikes and even breaks down the mRNA vaccine itself. The only thing left in your body are special B cells or memory cells. These can linger around for months or years until the same virus infects you again. When that happens, the B cells can produce the correct antibodies right away, preventing the virus from spreading and making you sick. What's interesting about this mRNA technique is that it's relatively quick to develop a vaccine as soon as we know the DNA or RNA sequence of a virus. And secondly, because the vaccine only makes our bodies produce a tiny part of a virus, we cannot get sick from it. More traditional vaccines use weakened versions of the actual virus. This also triggers an immune response, but could also give you mild symptoms. Now you know how mRNA vaccines work, but don't take my word for it.
Okay, great. Great. So hopefully that gives you a little bit of an explanation and helps answer some questions that you might have about the vaccine and its safety. The vaccine is not going to make you sick. It's just a little piece of the spike thing that won't make you sick. And there are 3 main types of COVID vaccines in the US, right? And so you've heard of the Pfizer vaccine, right? And the Moderna vaccine and the Johnson & Johnson vaccine. These are the 3 that are approved in the US at this time. So that's what they're, and right now, under emergency use authorization, the Pfizer vaccine can be given for people 12 years and up. And that was just recently, just a week or so ago. So that, the problem with this, it requires a really ultra cold refrigeration for that. Moderna vaccine is also available, but needs for emergency use authorization for 18 years and up. And then Johnson & Johnson vaccines are slightly different, but they are also for, I think, 18 and above as well. And the difference is only 1 dose. So it's important to take 2 doses, the first dose, and then you wait 3 weeks, and then you get the second dose. And Moderna is very similar. You get 2 doses, you take 1 dose, you wait 4 weeks, then you take another one. And it's really, really effective at preventing you get from getting sick. It's, if you know, it's like 94, 95%. It's not 100%, but it's really good at preventing you from getting sick, as well as from getting severely sick, the severity. Okay, so you've also been concerned there's vaccine side effects. So usually when you get your vaccine, right, people very commonly get pain on the arm where they got the vaccine. So the local reaction, you can get pain, redness, or swelling in that arm, right? And then you can have what we call systemic signs and symptoms, where your body, you have some tiredness, headache, muscle aches and pains, chills, fever, and nausea, right? So these are some of those signs that your body is trying to manufacture these, trying to learn how to recognize these spike proteins and build an immune response. So your body is building protection when you're feeling all this aching. But those side effects usually go away after a few days. So usually just 3 days or something like that, three days to up to a week. And some people have no side effects at all. And some people have a lot of side effects. So if you have other side effects that you're very concerned, you can speak to the doctor about that. I just want to note that if you notice some of these common side effects, it doesn't say shortness of breath. It doesn't say cough, right? It doesn't say things like that. So if you have things like shortness of breath and cough, then you better see the doctor about COVID, which is not, the vaccine doesn't give you shortness of breath or cough, right? Because it doesn't give you COVID. It just pushes on your immune system. Okay, some people get side effects from the first shot, and they have no symptoms on the second shot. Some people get symptoms on the first shot, and they have worse symptoms on the second shot. It can go either way. There's no guarantee it will be one way or the other. The other thing, just to be reassured that these side effects usually last up to 3 days, or even up to a week. But so you don't need to worry, they will go away. They recommend that you do not take Tylenol, ibuprofen, Motrin, those kinds of things, aspirin or antihistamines before the vaccine. You might think, oh, I'm going to get sick, I better take it first. No, you should take it after the vaccine if you develop side effects from the vaccine, but you should wait like 4 hours or so. But in the meantime, if your arm is aching and sore, you can use or it turns hot and red, right? Use a cool, wet washcloth over the area to soothe the discomfort, or use your arm, move it up and down, exercise your arm a little bit. And if you have a little fever, drink plenty of fluids and dress lightly, okay? Some people get what we call COVID arm, your arm where you get the shot, right? It's itchy, red, and swollen, but it may last a few days up to a week after the first shot. And if you do get the red swollen arm, you can take antihistamine and Tylenol, and it's fine. You can still take the shot in the other arm. You don't have to worry about it. It's not permanent. There are other concerns. People have been worried about allergies. Have you heard about that as well? It's not very common at all, but people do worry about if there is a very severe allergy called anaphylaxis, where instead of just having an allergy right at the spot of the injection, right, you can have redness, itching, or swelling on a part of the body that did not get the injection, and your whole body reacts, and you might have swelling of the lips or the eyes or tongue, or shortness of breath or wheezing immediately following, not immediately, within 4 hours, usually by 20 minutes right after the shot, or within 4 hours. So those are allergic reactions that could happen, but it's really not very common at all. In fact, it's on the order of something like 0.0001%. It's super low that people get allergic reactions from these vaccines. You may have heard that the Johnson & Johnson vaccine, there were some concerns. Some people were getting these rare, severe blood clots. So when blood clots happen in your body, you can get shortness of breath, leg pain, swelling, signs like stroke or weakness, severe headache, back pain, stomach pain, bruising, or tiny spots on the skin. And usually that occurs within 3 weeks. That's why you may have heard in the news that the J&J vaccine, they were paused for 3 weeks while they were undergoing some further study. But then afterwards, they decided that, this is super rare. It really hardly happens at all. And and actually it's not here. Yeah, so it happens in there was 6 cases in 7.5 million doses. So it's like 0.000001%. It's super, super rare. And of all the millions of shots given, just a couple of cases. And they all happened in women. I think it was young women between 18 and above the age of 18 or something like that. So they're while they're still giving out the shot now, they have a little black box warning and not to give it to those people. But otherwise, everybody else should be fine. And otherwise, it's very, very rare. But there is a way to report side effects. So when I'm sure some of you have gotten the shot already, hopefully. And hopefully you've also downloaded, there's something called the VSafe app to your smartphone. And basically it cues you in to do health check-ins. And you punch in whether you're feeling well today, having any symptoms or anything like that. And if you do have symptoms, there's a vaccine adverse event reporting system with a call. You can call or you can go online. Healthcare providers are required to report it by law, but anybody, you guys, can report this as well. But anyway, so these are the websites and the telephone number in case that you need to report side effects, although these side effects are quite rare. Just a note about allergies. As I said before, severe life-threatening reactions or anaphylaxis are extremely rare. They're and actually all vaccination sites are aware that this may happen, so they are all equipped to handle allergic emergencies. They have the medications right on site, and they have the medical personnel to handle it if it does happen. And all vaccination sites will monitor everyone who gets the shot. That's why you have to sit there for 15 to 30 minutes after the shot. If people have a history of anaphylaxis to food or insect stings or other medications, they can still receive the vaccine because, like I said before, super rare occurrence, but they will just be observed for 30 minutes instead of 15. If people have allergies, history of allergies, like they're allergic to grass or other things in the environment, they can get itchy eyes, runny nose. They can still get the vaccine and they only need to be observed for 15 minutes, just like everyone else. It doesn't put you, these types of environmental allergies like dust and stuff doesn't put you at higher risk for allergic reaction due to vaccine. The only reason vaccine should not be given if they already specifically had a really bad reaction to the first one, or they are specifically allergic to some ingredients inside the vaccine. But yeah, there's before taking the vaccine, there's this pre-vaccine checklist that CDC has, and it's basically all the questions that I brought up in the last couple of slides, talking about if you've ever had a severe allergic reaction, have you ever had COVID, do you have a weakened immune system, do you have any bleeding disorders and clotting disorders, that kind of thing. And so it's just so that people who are monitoring are aware. There are, you may have heard that there are COVID variants out there now, right? Oftentimes when an infection has been out in the community for a little while, like the flu, right, that it mutates and it tries to be sneaky and it mutates and it changes its form, and so it can continue to infect the population. So they're constantly changing by mutation. So we've had this original COVID around for like a year now, and now we're starting to detect other variants in the world. So in the UK, right, they started having this UK variant and it came into the US in December. And right now it's kind of in many of the states. In fact, it's the predominant variant circulating in the US at this time, is the UK variant. There are other variants from South Africa variant. It entered the US in January 2021, Brazil as well. And then February, California had 2 different variants, one in different regions of California, and those are circulating. And of course, we've seen the news in India. India has its own variant that can be circulating as well. So they are, these variants, they seem to spread more easily and more quickly than the original variant, which is a little bit scary, right? But so far, what we're seeing right now, the vaccine, like the Pfizer and the Moderna, those guys, these vaccines can recognize these variants already. So if you get the vaccine to this one, you have a very good chance that it will recognize these guys and fight against them as well. So that's a good thing. There was concern at the beginning that it may or may not, but it may be not the same effectiveness, but it does fight against these. So the more these different variants enter our community, the higher likelihood that more mutations will develop. So that's why we want to stop COVID completely, so that we don't get more variants too, because once we stop it from circulating, then they won't be mutating either. Anyway, CDC is following all of these different variants very, very carefully. And because of all the different variants, people are considering making new shots, new vaccines for each thing. It's kind of similar like the flu vaccine, but these are all relatively new. So these are just going to be people are studying them right now. Okay, so which is why it's really important for all of us to get these vaccines, because it should protect us from many of the variants. So I just want to mention that there are people at higher risk for severe COVID if they do not get the vaccine. So that's why, remember when they were rolling this out, they said, oh, we got to get the Kupuna first, right? It's the older patients who have weaker immune systems. They can't fight the virus as well, and they may have a lower response to the vaccine when they do get it. So these are very special populations that we have to protect. So immunocompromised patients, so those are people like people on, transplant patients who have transplants like liver, kidney transplants, and they have to take medicines to stop their body from rejecting the organs, or people with cancer or autoimmune disease where they're taking medicines to stop the immune system. Those are people at high risk, and they definitely should get vaccinated. Because even if they get vaccinated, their response is still not quite as strong as the others. Other people at risk for severe cases are people who have diabetes and lung disease, or are obese, or have overweight, things like that, have higher risk for severe cases because their body is more vulnerable. Pregnant women is another category here. Pregnant women, when you are pregnant, your body is trying to help this baby in your body grow. And so it suppresses the immune system so it doesn't reject the baby, right? And so when you're pregnant, you actually are relatively immunocompromised. And so you're at higher risk for getting the disease. So that's why even though people may be afraid to get the vaccine because they don't want to hurt the baby, it actually may be at higher risk to get the disease. So that's why we actually encourage pregnant women to get the vaccine so that they won't get sick. They won't get the COVID in the community. However, have to beware of high fevers and, take Tylenol if you have high fevers. So where do you get vaccines? Hopefully, you've found some vaccines already. That they had some of those clinics that have been open and some of the pharmacies. But you can also, go to vaccines.gov or call the 1-800 number. Some places are now doing appointments or walk-in. And for those who are 65 and older, you can also call 211, and that's a Kupuna call center, and you can talk to a trained specialist who can help you schedule and access a vaccine. So this was organized by AUW, so that's very helpful. Okay, I want to caution, you would think, well, we're all super happy that the vaccine is out. But, vaccine does not guarantee that you won't get COVID. Some people think, oh yeah, now I'm not going to get COVID, no more masks, I can just go out. It won't guarantee that you won't get COVID. Remember, you saw those numbers like 94%, 95, 96%. It's not 100%. There's still a tiny bit of people who could still get sick. So that's why it's not guaranteed, but it protects most people. And even if you do get sick, you probably won't wind up in the ICU or in the hospital. You might just get sick and need to lie in bed for a few days, that kind of thing, So you can still get the virus. You may have fewer symptoms or no symptoms. And because your body is fighting it, it's attacking it a lot faster, you're less likely to spread it because you don't have as high of a viral load raging in your body. So you have fewer viral cells in your body, so you won't spread it as easily. But because it's not guaranteed, we still have to take precautions with mask, distance, and hand washing. So now there's these new CDC guidance, right? You've heard that they said, oh yeah, so if you're vaccinated, you get a free pass and you don't have to wear your mask anymore. Well, it's not quite like that. These do help, and these new relaxing rules for vaccinated people apply mostly to the healthy people in the community. So if you've gotten vaccinated and you want to go visit your friend in their home without a mask, that's cool, or you go to visit with one household, and they're not at risk for severe disease, that's okay. you know, if you want to travel and not get the COVID test, right, as a travel requirement, then that's cool. So it does give you a little bit of a free pass. But the thing I really want to note here, and the reason why we're talking to you guys in particular, is because it doesn't actually apply to healthcare settings. So, you know, basically you should not visit indoors without a mask with people at increased risk for severe illness or attend medium or large gatherings. So it does not apply to healthcare settings, and it does not apply for vulnerable elders, for those people living in places like nursing homes, assisted living, foster or care homes, and especially not for people with immunocompromising conditions like cancer, transplant, rheumatoid arthritis, those on medications that suppress their immune system. So yeah, so we still need to look out for and protect our kupuna, although the rest of the population may be able to go out and do that amongst other vaccinated people. Our population are still at very high risk. So with regards to visitation recommendations, while we may be out of lockdown, we can't really go back to normal as it was before. This is what we call, we'll have to realize we're going to be in this new normal. So just sort of think about, what does this mean in your facility? So in general, if you are a fully vaccinated caregiver, you should continue to wear your mask at work. However, if you're at work and everybody at work is vaccinated, then you can dine and socialize together in break rooms without a mask, right? And conduct in-person meetings without a mask or social distancing. Okay, so that is a little bit of a freedom. But if you are fully vaccinated and there is one person in the room who is not vaccinated, and you don't know if they're vaccinated or not, then everyone in the room should wear a mask, and the unvaccinated person should physically distance from others, right? Because that person is not protected. So that's what it means for fully vaccinated healthcare providers, right? So while you're in the break room, you can take off your mask and eat together. But if you're going to go out in the common area and you're working with your older adults, you need to wear that mask. What about group activities in your facility? If all patients and residents participating in the activity are fully vaccinated, then they can choose to have close contact and not wear a mask. But if there's one person, one patient or one resident present, then everybody in the activity needs to wear a mask and physically distance from everyone. Okay. With regards to eating together, if you are fully vaccinated, patients and residents, they can eat together without source control or physical distancing. If there's an unvaccinated patient or resident dining in the common area, then all residents have to wear masks and physically distance and remain 6 feet apart from each other, you know, and probably time the meal separately. So yeah. What else? What about taking residents out? So a lot of people think, oh yes, we can go to restaurants now, right? Well, there's lots of risks about going to restaurants because it's a public setting and we don't know if the waiter is vaccinated. We don't know if people at the other table are vaccinated. These are not people we know. So they present a risk, and it's a poorly ventilated space. Usually most restaurants are, if it's indoors, you don't have the air circulating around. So that, there's a lot of people crowded together. And so this virus is spread in the air. And so, going out to restaurants is probably not a good idea. And going out to public places. So we need to stick with wearing a mask, physical distance, and hand washing, even when visiting friends or families in private settings. So when you have family members coming and say, hey, I want to take my mom out for Mother's Day. Yeah, we're going to go to this restaurant, and we're going to go, then no, that's risky, right? Or if you're going to be in a setting where all these people are, you don't know everybody there, and maybe there's one or two people who don't like vaccines, and you don't know if they've been at different situations. So in general, if these are, we would strongly recommend that we do not take our kupuna out to go to public places with crowds and poorly ventilated. So what about admissions? So, the same thing, what we would strongly recommend for care home operators to follow what the nursing homes are doing. And what are nursing homes doing? If new residents to the nursing homes are not vaccinated, then you should put them in a quarantine or observation room for 14 days before they can come out and mingle with the rest of the residents, because we don't know what their status is. And the incubation period, they may turn up positive, we don't know. But as most care homes are, and most nursing homes, if there's no space for quarantine or observation, then full vaccination prior to admission is probably safest to go. So if you're saying, oh, somebody wants to do an admission, ask them if they're vaccinated. If they're not vaccinated, then and you can't put them in quarantine for 14 days, then say, no, you go get vaccinated first and then you can come. That's safer. The safest scenario, of course, is to do both. So accept only fully vaccinated residents and then place them under quarantine for 14 days before allowing them to mingle with the other residents. But as we said before, this part's often quite hard. And so we just do the best we can, which is, I would say, full vaccination prior to admission. And this is really because our older adults just can't fight infections very well, and they could get quite sick. Okay, so what about visiting recommendations even after vaccinations? For families and visitors, right? Visitors must be screened, right? Just as you're doing, you screen everybody for temperature and symptoms before coming in. They don't recommend visitor testing is not required, but it's recommended if community cases are high. Visitors must wear face masks, stay 6 feet apart, and do hand washing, and then limit visitor movement inside the home. Families may not take the resident to go out for dinner, church, or other family gatherings because those are larger crowds with poor ventilation, whatever. And for care homes, that means, and also same with nursing homes, right? Scheduling visits to limit the number of visitors to the home per individual and at any given time. Consider limiting the length of visits, and on-site visits should be supervised until families demonstrate consistent compliance. Outdoor visits are always preferable. Indoor visits only if both visitors and residents are vaccinated, and there's a designated visiting area with good airflow, right? Then that might be okay, and not wear mask. No visits in shared rooms and no indoor visits if the number of cases in the community start going up. Right now, the cases are stable or going down, but if they start going up, you have to stop those visits as well. So see, this mask is masked and vaccinated, so you can do both. And so I am going to open up for questions, and I'm sure you guys have questions. So I see. Okay, do we have questions? And let's see if anybody here.
Naomi had a question. She said, anecdotally, I've heard of, I'll post it in the chat for you to read aloud.
I see that, yes.
Okay.
I've heard of recrudescence of herpes zoster and HSV 2 days, a day after the second vaccine. Is there any info as whether taking the indicated antiviral will lessen the ability to develop immunity? I don't know. I think people don't know that, but I think it makes sense that sometimes, it does, your body is revved up when you get vaccines, right? And usually they don't recommend taking the COVID vaccine within, I think, a week of taking other vaccines. And I would also think that other antivirals would be similar. I mean, it may not attack exactly the same, mechanism wise, it's not attacking the same exact antigen, but I don't know, maybe it does, your body is ramped up and it may affect or alter the way it is that it responds. So I don't know. The full list of ingredients in each vaccine, I don't know. There must be a place to find it, maybe online. What ingredients are derived from GMOs? What is the glyphosate content? I don't know. Bt toxin. Yeah, I don't know what the ingredients are.
Hi,
Hmm.
I have some question.
Yes.
Okay, is caregiver can tell the family not to get a vaccine for the client because it's not good for them?
Oh, why would it not be good for the client?
I just heard that somewhere that some of the, what is that, caregiver told the family, don't let your mom have a vaccine because it's not good for them.
Yeah, that's not true, and that's not recommended by the Department of Health or the CDC. In fact, and as a geriatrician as well, older adults are at higher risk if they get the sure, they may get side effects from getting the vaccine, but if they get the COVID itself, they're at higher risk for getting very, very sick.
Yeah, so I told the
It's
family
all
that
risk.
just
It's a risk.
I told the family that go ask her doctor if
Yes.
can.
Yes.
That caregiver don't have any business to tell you not to have a vaccine for your mom because he's not a doctor. She don't know anything about that.
I
She don't
think
know.
that's a good idea. Definitely
I
refer.
said, go ask the doctor, your mom's doctor to if it is okay to your mom to have a vaccine.
Yeah, I think that's probably the best advice because they're probably getting advice from many, many different people. So
Probably.
yeah. But the doctor knows the mother's condition, and knows, if they have diabetes or if they're on certain medications that put them at higher risk. So I think that's a good idea.
Thanks.
So Joanne asks, so if a new resident is not vaccinated before admission, we can refuse the resident?
Well, it depends on how safe you want your facility to be. When you take a resident that's not vaccinated, you basically, you take a risk. Because this person who comes in may not have symptoms, but they may have the disease, they may have the COVID that they could share, right? So the best way to guarantee it is there's no guarantee, but the best way to reduce the risk is to have both vaccines, be fully vaccinated.
Ruth Wong from Kuakini says, we are finding it difficult to schedule the second vaccine once admitted. Our resources times Lily Hill cannot reserve vaccines. It depends upon what is left for that day. Is there one pharmacy that could be given just for nursing home residents?
You know what? We've been battling that question. You don't know how many times we've gone to fight for both the nursing homes as well as the care homes. 'Cause this is a difficult question. I think that, we really should have been thinking about this ahead of time. And if, somebody we have, I think Douglas Hatch, Dr. Hatch from DOH said he would be joining us, and I don't know if he is on with us.
Yes, I'm on.
Oh, you are? Okay, yeah. So I guess that's the question. So some people are having trouble scheduling the second vaccine once they're admitted. They may get the first vaccine outside, but it's hard for the nursing home residents to get the second vaccine, or even care home residents, because their pharmacies don't carry them. And they have to do the runaround and call around. So it's kind of,
Yeah. I had an excellent presentation that was comprehensive and informative, so thanks for giving that. I would guess that Curtis Toma would probably be the most knowledgeable about that. He and the private pharmacies had set up a program where there was contracts to do both the first and second vaccinations, and I believe they visited thousands of locations to set that up. For those that either were not present the day that they were there, or still need the second dose if they received the Moderna or the Pfizer. We can get that information, but I don't have it in front of me immediately.
yeah. So part of the problem was there was a bunch of vaccine hesitancy at the beginning, and so they did not get the vaccine. But then once the program was over and the pharmacists did not, the contracted pharmacies did not come back
Right.
to the facility, then they kind of left out. And
So I'm assuming that discussion is continuing, but of course, people from the pharmacies can't do it without a clear contract to do it. So
Right.
I assume that coordination will occur, but we'll have to check in with Curtis to get sort of an update on that. Over.
yeah, that would be great. Yeah. So that's something that still needs work. And I think they're working on a contract, Ruth, for the nursing homes with Pharmerica as well. I think that's in the works.
Isabel says, for example, I have 2 sets of vaccines already. Do I still have to do COVID testing if I come back from the mainland, or just do quarantine? There's no vaccine passport as of right now coming into Hawaii, I believe. I do think that you still have to get the test done or quarantine. There's Inter Island for fully vaccinated open right now, but not coming in from the mainland.
Yeah, I think that Hawaii is a little more conservative than other places on the mainland.
So what if the family member of the resident says they don't want the resident to take the vaccine? Oh, we already had that question pop up.
Well, we just have to find out what they're afraid of, what their concerns are, and see if we can answer some of those questions. Maybe they don't understand the science, or they think, oh, this is going to change my DNA, or maybe this is, going to give me COVID, or maybe there's, they think maybe this is, I don't know. People have, oh, this is made from fetal cells from abortion. Those are all not true. I tried to show you the video to show that this is not, these are just some basic science. So it's been well studied, and it seems like this happened very quickly, but it actually, the research behind it has been going on for many, many years. So it's not entirely.
And we know, Dr. Nguyen, we know that, there have been more than 500,000 deaths associated with COVID disease. And there have been very few deaths associated with the vaccine, although there have been some adverse events. So if you compare those two numbers, there should be a clear idea in everybody's mind about there being safe and effective vaccines. And even the Vatican has issued proclamations suggesting there should be equitable distribution of vaccines, that people have responsibility both to protect themselves and to protect people around them. Because if you get vaccinated, you're less likely to transmit it to your neighbor or someone at the church or your children or, the grandparent. So part of it's just taking responsibility to make sure that those people that are more vulnerable don't get the infection.
I would frame it
Over.
like it's about it's demonstrating your care and your love. It's demonstrating aloha to others. I mean, you may be fine, but somebody else's mother won't be.
Correct.
So, yeah, why aren't everybody in total agreement? Well, I don't know, because this is not a perfect world, but if you weigh the evidence, there are risks. There's nothing perfect. Bad reactions happen, it's not 100%. But if you weigh the risks and the benefits, I think that it really weighs in favor of the vaccine is better for the public and for our kupuna. And since we are in that business, we need to take that special responsibility to protect those that we care for, even more than the general public might have to.
Right, and international travel would be another thing to consider. I mean, in addition to protecting those around you, if you're traveling, it would protect people around you that are traveling. But, Europe is beginning to open up for international travel, Asia the same way. And although they're not every country is requiring documented vaccination before travel, countries like France and others require the equivalent of a vaccine passport. So I think it's fairly clear over time, if you do international travel, it's going to be required in the future in all likelihood.
Yeah. So I have a question about a 16-year-old daughter go to the dentist and get teeth x-ray the next day after her first COVID-19 vaccine. Well, I suppose, everything is a risk and benefit, right? So she doesn't really have immunity yet. She just got one, and she still has a few weeks, 3 weeks or so to before her second vaccine. And then after that, 2 more weeks. However, if she has a dental problem and she's got cavities and, an abscess or an infection, those things matter too. And have to, weigh those in. I think it's not just one-sided. And certainly the dentists take lots of precautions because they're in people's mouths. And so I think they do a lot of hygiene and hand washing for sure.
Can I
Right.
interject? I was just wondering that because we serve the fragile and elderly community, and in comparison with DOE right now and the University of Hawaii, they're making it mandate as that they should be vaccinated before going back to school. Why can't the state make it mandated that when an admission comes to a home, that they should take that also, because it's our protection as a caregiver, and also they're coming into an environment where everybody's safe and we're all vaccinated. I mean, I am, my patient is, and my caregivers are, and for that to say, and then someone is coming in, and then if they say, oh, my mom doesn't want to take her vaccine because of what she's been hearing from family members and so on. I mean, I, as an independent businesswoman, that is like a question that I would say, do I take that risk? But at the same token, I think there should be a mandate to say, hey, if you want someone to take care of your mom, I think that you should reconsider getting a vaccine.
Yeah. I think part of the issue is that it's still under quote unquote emergency use authorization. So nobody can mandate anything if it's under emergency use. So
Yeah,
hopefully-
unfortunately, and then
hopefully
at the
that'll
same
be
time,
taken care of soon. I think that's in the works. I think they're looking at full, I think they put the application in already for full
yeah,
authorization.
I hope so. I hope so. And you know, I agree that everybody have their rights to choose. But at this time, you're also endangering other people as well when you're coming into an environment where it is protected.
However, private companies, stores, restaurants, anybody, they're not, they can make their own rules.
That's true. That is true.
They can decide their own rules. So,
Yeah.
but I think as an industry, I mean, that's the recommendation, just to be, because our population is more vulnerable. It's not just like, oh, you want to go to a movie or not.
That's right.
It's not quite like that,
Mhm. Well, thank you for listening.
Yeah. Okay, so, oh yeah, go ahead. Yeah, we're kind of past time, so I'm gonna let Michaela walk us through getting the certificates of attendance.
Hi, everyone. So I posted the link inside the chat box. You should be able to click it and just automatically go to it. If you're unable to click on that link, you can type it into your chat box. I wanted to show you here. So it's CH for care home, echo, and then eval. When you get to the evaluation, everybody that views this has to fill out one independently. So please put in an email, your full name, the date of the session, and what kind of certificate you want, and then fill it out. And at the very bottom, you have to make sure that you hit the submit button. Now, everybody has to fill out one independently. We had quite a few people last time fill out multiple names under one section, and we use an auto-generated certificate program that will send you a certificate with everybody's name on it. Not every single individual person will get their own. So you have to fill out one for every single person. Here's our flyer over here. I did want to point out another link where you could access this evaluation at any time, or information on our echo. So if you go to
Okay.
this one down here,
I had some question.
Yes.
What should we write the certification?
so you need to select if you are
What
a
is that?
doctor or a nurse, you can select this continuing medical education one. If you're a social worker, you can select this one. If you're a care home operator or CNA, you can select certificate of attendance. That's the
Oh,
C
okay.
that will generate yours.
Okay, thank
So
you.
if you did not select certificate of attendance, there's a chance that you did not get a certificate. And then
Okay, thank
I'm
you.
going to send you a couple of emails to follow up with if you did not get a certificate last time. But first, I want to show everybody our website. So here we have, if you type in tiny URL, care home echo-info, you're going to be redirected to our care home echo website. And here you're going to see different links. Here's where you can register at any time. You just click this and it takes you to our registration tab. You're going to be able to find our evaluation form on this one. Our case presentations, if you ever have a case that you want us to address in our echoes, you can come here and fill out our online form. And we'll share it and try to come up with a good answer for you. Please make sure that when you share, you keep everything HIPAA compliant, meaning that you don't share any confidential information about the client that you're talking about. Here you can see our list of upcoming echoes and recordings of our echoes. If you hit this little plus button, you can come back and view our echo session at any time. We'll also be posting any relevant resources that you guys can come back to here. And there's some videos here on how to use Zoom if you needed it. So coming back to the evaluation, if you did not receive your certificate last time, or you're having trouble, you can always email John at this email down here, or you can email myself. And I'm going to put our emails into the chat box right now. We give everybody, sorry, my baby is getting all riled up. He's ready to talk with everybody else. And if you did not receive your certificate last time, there might have been a problem with the auto generation or you selected the wrong certificate. So if you could email us, that would be good. We use an automated service. We give you until Monday to complete it, or Sunday until complete it. And then on Monday mornings, we send out certificates. I'm going to stop this share right now and give everybody a chance to fill
Can I have
out.
a question?
Go ahead.
Oh yeah, I had never registered all my my substitute caregiver. So I can do it that one the next time if we have a meeting.
You never registered what?
My substitute caregiver for that for today meeting.
Did
So
she
they-
attend?
Yeah.
Yeah,
Okay,
I think-
well, I mean, if you chat her name into the box, that's how we keep attendance because not everybody registers. We understand that multiple people can be viewing from one screen, which is
Yeah,
why we
yeah.
have people chat in everybody's names. And then just every single person who viewed has to complete
Okay.
an evaluation. And that's how we send out certificates.
Okay. Thank you so much.
All right, I'll put that link back into the chat box.
I see some hands up from Roman and Nisita. Do you guys have a question?
Oh, no, I'm done.
Oh, okay. Then put the hands down. Yeah.
Thank you.
Michaela, this is Maribel. I have the list for the AFA members who didn't get certificate. I will email you later. I'm just in the school right now. So I'll email you after this.
Okay, thank you very much.
Thanks.
Great. Everybody else is good?
Yes.
Okay, great. So, there's the slide deck will be posted in the website if you want to see. After the questions slide, I actually have a whole bunch of FAQ slides, frequently asked questions. And so that actually might answer some other questions that people had in the chat box. So you can go ahead and take a look at that. In particular, I saw if you're a COVID survivor, do you still need COVID vaccine? And the answer is yes. It's still highly recommended. You get a stronger response from the vaccine than you do from just getting natural infection. So, and besides, you want to get the vaccine because you want to be protected from the variants, not just the one that you just got. So anyway. All right, hope that was helpful, everybody.
Thank you so much.
Thank you. Wait.
Check box. Check box. Chanda yung from video.
Dr. Hatch, thanks so much for joining us today.
Thank you.
Check box.